The coronavirus has become an international concern of epic proportion. But how can you protect yourself from something that you can't see? Find out the top 10 things you can do to keep yourself safe from getting sick from the coronavirus on today's episode of This Old Tooth. Hello, everyone. You are listening to This Old Tooth, a podcast devoted to providing you with honest, agenda-free information about how you can get and keep a beautiful, healthy smile for life. I am your host, Dr. Lisa Germain. As I mentioned on my last episode, it is my goal for 2020 to discuss dental topics that relate to overall wellness. So today, I will discuss a topic that has dominated the news media and has instilled fear in us all: the coronavirus, also called COVID-19. As the coronavirus creates speculation of an international pandemic, you might be asking yourself, how do I protect myself from something I cannot see? Therefore, today I will present you with some facts about the coronavirus, as well as the top 10 things you can do to protect yourself and your family from getting sick. There are many types of coronavirus strains that cause illness. They range in severity from the common cold to severe acute respiratory syndrome, SARS, and Middle Eastern respiratory syndrome, or MERS. COVID-19, also called novel coronavirus, is a new strain that has never been previously identified in humans. While the complete clinical picture with regard to COVID-19 is not fully understood, reported illnesses have ranged from mild to severe. Symptoms include respiratory infection, fever, cough, shortness of breath, and difficulty breathing. In the more severe cases, infection can cause pneumonia, life-threatening respiratory failure, and/or kidney failure. Symptoms may appear anywhere between 2 to 14 days after exposure. The disease appears to become more severe with age, with the 30 to 79-year-old age range predominating. The really good news is that children seem to be at less risk of suffering noticeable symptoms of the disease. The demographic most likely to survive an infection, the young and healthy, may need to pay the closest attention to preventative measures. These are the people who will spread the disease while believing that they only have a cold. They can infect the elderly or people who have chronic diseases or immune conditions that are less likely to survive. Now, I have no claim on the information that I've used to compile my top 10 tips to defend yourself against the virus. As a dentist, I can tell you that we are all trained to take universal precautions to protect our patients, our team members, and ourselves against all viruses, all bacteria, and all disease processes. So along with what we do in my office, as a matter of course, and some common sense, I have just compiled what I personally feel would be good precautions for you to take to keep you as safe as possible. Tip number 1, wash your hands with hot water and soap for 20 seconds frequently, and when you do, sing happy birthday to yourself twice. It is about the correct amount of time to get them physically clean. You can use hand sanitizer in between, but make sure it has at least 60% alcohol content. Generally speaking, alcohol-based hand sanitizers kill germs by disrupting the membranes of various microorganisms. You can find more gentle ones that claim are all natural and won't dry out your skin. However, if they don't contain alcohol, they will not work. In New Orleans, where I live, hand sanitizer has been very difficult to find, so I found this recipe to make my own. In a bowl, mix 1/3 cup of aloe vera gel or vegetable glycerin with 2/3 cup of rubbing alcohol or isopropyl alcohol until it's blended. You can also add a few drops of essential oils to make it smell better, but of course, that is optional. In addition, wash your hand towels frequently in hot water. Tip number 2, Clean your cell phone. It probably has more germs on it than any other item that we use on a daily basis. If you have been touching your phone with dirty hands, then you do a beautiful job washing those hands, and then you touch your phone again, you may have just recontaminated yourself. I suggest that you Google safe ways to clean your cell phone, or ask your cell phone provider. Tip number 3. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, keyboards, toilets, faucets, sinks, and even the steering wheel in your car. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Now, to disinfect, most common EPA-registered household disinfectants will work. Use disinfectants appropriate for the surface. You can also make your own solution. Unexpired household bleach will be effective against coronaviruses when properly diluted. Use 4 teaspoons of bleach per quart of water and decant it into a spray bottle. Remember to take precautions to protect your clothing when using this solution, and use rubber gloves to protect your hands. Tip number 4. Avoid touching your face, particularly your eyes, nose, and mouth. While this is a nice idea and would be very effective, it is difficult to break this habit. It is estimated that people touch their faces about 23 times per hour. When you touch your face with dirty, unwashed hands, germs can take up residence in your mucous membranes inside your mouth, eyes, and nose, and this can lead to an infection. Tip number 5. Avoid close contact with people that are sick. Respiratory infections like pneumonia or the flu can spread through droplets in the air when a sick person coughs, sneezes, or talks near you. Respiratory infections can also spread by direct contact with bacteria, viruses, and other disease-causing germs. When we touch people who are sick or are close enough for airborne viral spread, we become more susceptible to becoming ill. If you are caring for someone who is ill, you and everyone in the household need to take extra precautions by wearing disposable gloves when cleaning surfaces, as well as when handling clothing, towels, and bed linens from a person who is ill. Gloves should be disposed of and hands washed immediately afterwards. Tip number 6. Avoid shaking hands with people. In certain instances, asymptomatic infected individuals have been reported to be the source of spreading the coronavirus to others. Fist bumping and elbow-to-elbow contact have become common acceptable ways to greet others. Tip number 7. Avoid discretionary travel, and certainly it is always advisable to avoid travel if you are ill. But stay-home directives are not sustainable for long periods because there is also the possibility that urgent life events will overlap with this outbreak. Remember that if you do travel, airplanes recirculate the air, and there are so many people in airports that close contact becomes unavoidable. As more and more places are being affected, you also run the risk of being stranded or quarantined, which could put you in a situation of greater exposure to the virus. Be extra cautious about hand washing and surface disinfection if you need to travel. Tip number 8. Take care of yourself and keep your immune system healthy. This has never been more important. COVID-19 seems to affect people whose health is already compromised. Exercise regularly, eat healthy, get plenty of rest, hydrate often, and take your prescription medications as directed. Tip number 9. Stop smoking and/or vaping. If this advice is followed by only one listener, I will be thrilled. The coronavirus infection is a form of the flu, but if it gets to your lungs, it can cause pneumonia. This is more likely to happen if you have a habit where you routinely inhale things other than plain oxygen that would assuredly give you diminished lung capacity. The majority of people who have died from COVID-19 might have survived if they had not developed severe respiratory failure. And number 10, seek medical attention if you are feeling ill. Early detection and intervention are key elements to complete recovery in the unlikely event that you become infected with COVID-19. It is truly my wish that you all stay safe and healthy. We can only hope for containment of this virus and a vaccination to be developed as soon as possible. And now for a fun fact. The stone-faced farmer and artist Grant Wood's famous American Gothic painting was actually the artist's dentist. If you have any questions about your dental health, please go to my website, thisoldtooth.com, and go to the Contact Me section. I would love to answer your question on the air and give you a shout out. And it is also my greatest wish that you subscribe to my podcast. You can do that wherever you are listening to it now. And to all of you out there, I hope you stay healthy. Thank you for listening, and until next time, remember, be true to your teeth, or they will be false to you.